Dr. Benjamin sometime during the meeting if we have some questions or whatever, but because we have a full agenda, we're moving forward. And we have an excellent panel that our next discussion that's got our attention across the country is the balance. But I do want to thank Dr. Benjamin for his remarks and his insight. And so thank you so very much. Now, our first panel this morning is gun prevention. Where do we go from here? It is crucial for us to acknowledge the profound impact that gun violence has on individuals, families, and communities across the globe. Every year, hundreds of thousands of lives are affected, leaving lasting scars and prompting urgent calls for action. Gun violence is a multifaceted issue. It's influenced by a range of factors, including socioeconomic conditions, mental health, and access to firearms. It is not confined in any one region or demographic, making it a universal challenge that requires a comprehensive and collaborative approach to address. Now, this panel will delve into various aspects of this complex issue. We're exploring evidence-based strategies for prevention, the role of policy and legislation, and the importance of community engagement and support systems. We will hear from experts who bring diverse perspectives and insights, helping us to better understand the root causes and potential solutions to reduce gun violence. Now, as we embark on this conversation, let us remain committed to fostering a dialogue that is both respectful and constructive, with the shared goal of creating safer environments for all. So right now, I would like to invite our panel to the stage. Our moderator for this session is one of our fierce advocates on the issue of gun violence prevention. Dr. Michael McGee is a compassionate, caring physician who has been practicing emergency medicine since 2004. He's a child prodigy, as you must know. Dr. McGee supports various youth programs focused on violence prevention within the communities of NWI and Chicago, Northwestern Illinois.
Indiana.
Is it Indiana? Sorry, I will get it correct. Thank you. He created a youth health awareness and violence prevention outreach program called Project Outreach and Prevent on Teen Violence, Incorporated. He now serves as the chair of the NMA's Council on Violence Prevention, and he's been a driving force behind introducing the Stop the Bleed training at our annual convention and scientific assembly. So please welcome now our moderator, Dr. Michael McGee. This is a special guest here on the panel.
Good morning. Good morning. How you guys doing? You awake?
Yes.
All right. So I'm not even going to start telling you about myself just yet. I'm going to start by first giving you a quick overview of some of the things that we're going to talk about in this brief moment. Then I'm going to introduce my illustrious guests. First, we're going to pretty much introduce the panel. Then I'm going to do a quick presentation just showing you the impact. Should be less than 7 minutes. Then each of the panelists are going to have about 5 minutes to tell you more about some of the wonderful things that they're doing in this space. And then after that, we're going to open it up to you guys to ask a few questions, about 15 to 20 minutes. Actually going to pass the mic for you guys to have your voice to be heard. And then I'm going to end that with a quick call to action and show you some solutions and some things that this panel, this council, Violence Prevention Council is working on. So with that being said and done, I'm going to start by fully introducing the bio of our panelists here. So my friend and wonderful person that everybody loves in Illinois is Congresswoman Robin Kelly. So please clap it up for her. Let me just tell you this. Robin will show up all the time. There's no doubt on that, and she does that for her constituents in Illinois as well.
Yeah.
So Robin is the daughter of a small business owner and postal worker. She moved to Illinois to attend Bradley University in Peoria, where she earned her BA in psychology, as well as an MA in counseling. She has a PhD in political science, so she's Dr. Robin Kelly. Right? So she finished that from Northern Illinois University. She also is an active member of Sigma Gamma Rho. I love the blue. So she is doing some wonderful things. Since getting elected to serve the 2nd Congressional District in 2013, she has worked to expand economic opportunities, community wellness, and public safety across the state. She's championed numerous initiatives to generate job growth, reduce health disparities, and of course, end gun violence. She is a member of the House Energy and Commerce Committee, which is the main policy writing body of the House, which focuses on expanding access to health care and doing a bunch of amazing things. She's also a member of the House Democratic Steering and Policy Committee as well. A staunch champion of common sense gun reforms and responsible community policing, Robin is the co-chair of the Congressional Gun Violence Prevention Task Force and is the author of the 2014 Kelly Report on Gun Violence in America, the first ever congressional analyst of the nation's gun violence epidemic that offers a blueprint for ending this crisis. She's been there. She's done those things. One of the first persons in Congress to do that. Committed to improving the health and wellness of vulnerable communities across the country, Congresswoman Robin Kelly also serves as the Congressional Black Caucus Health Brain Trust. So please clap it up for Robin Kelly. The next person I think is a native of D.C. Is that right? Dr. Swann? I am. All right. Dr. Swann is an alumni of the University of Maryland College Park. She attended the University of California, UCLA, and became a doctor. She has her MD. But then she said, look, I want to do more. So she actually went to law school and also has a JD as well. So she assumes the role of Chief Administrative Officer at the Hop Caucus, where she oversees operations, human resources, government relations, and legal affairs in alignment with the organization's mission of empowering marginalized communities. Recognized as an inspiring and innovative leader, Dr. Swann remains at the forefront of initiatives focused on policy reform, civil rights, and environmental justice, drawing on her extensive expertise towards driving impactful changes. In addition to her organizational duties, Dr. Swann actively engages in policy advocacy and coalition building endeavors as an esteemed member of the American Bar Association. She also initiates promoting equity and fairness. Dr. Swann's strategic partnerships and global collaborations underscore her commitment to effecting systemic change on a global scale. Please clap it up for Dr. Swann. Sitting next to her is Mannone Butler. Mannone is also a native of Washington. She earned her BS in finance from Georgetown and got her JD from Georgetown as well. She is currently serving on Georgetown's board of directors and was the inaugural chair of Georgetown's Black Alumni Council. Ms. Butler is an accomplished executive and justice system professional, blending over 2 decades of legal and policy experience with her passion for justice and equity. She currently serves as the head of programs and partnerships for the NBA. They have a coalition, a social justice coalition established in 2020 by players, coaches, team governors, and league executives to lead the NBA family social justice advocacy. She spearheads development and implementation of the coalition's policy, agenda, and stakeholder engagement efforts. Prior to joining the coalition, Ms. Butler led the District of Columbia Criminal Justice Coordinating Council, an independent justice agency comprised of federal and local justice agencies that addresses the district's criminal and juvenile justice issues, as well as oversaw the jurisdiction's integrated justice information sharing system. Please clap it up for her. The last person was not able to make it today. He had some plane problems and was stranded in Chicago. But without that, we're still going to move forward with his testimony. He gave a 5-minute video that he wanted to address to you guys. But that person is Greg Jackson. Greg Jackson is the former Deputy Director of the White House Office of Gun Violence Prevention. He is currently the Executive Director of Community Justice Action Fund. He's also a gun victim, survivor. He was shot in the past, and he's going to mention that in this video. So please clap it up for Greg, even though he's not here. So we're going to go ahead and get started. I hope you guys saw this. It's very important that we don't stay silent about all the issues that are going on. And it's only going to get worse, as you guys already know. So quickly, for myself, I'm an ER doc. I am the medical director of ER at University of Chicago in Indiana. Yes, UC decided to venture out to Indiana and open up a micro hospital that I'm the director of, as well as the president of medical staff. But my passion is doing what I do for my nonprofit, which is POP. There's some information on the table for you guys to check out, and we'll discuss it a little bit later. But I was blessed or voluntold to be the chair for this particular council after joining the Gun Violence Task Force, the NMA. They decided we needed to do more. So they decided to be a council to the House of Delegates, and I became the chair for that. I'm also the chair for ACEP. This is the American College of Emergency Physicians. These are all the 40,000 ER docs all over the country. They felt that there was a need to have a violence prevention council as well. So I chair that. I'm also a member of AMA's task force. So we're doing some amazing things, and we're going to briefly talk about some of the things. So you guys already know, there's a bunch of things that are happening in this country that has only gotten worse. So this title is The Impact of Gun Violence, and where do we go from here? And our kids are under siege. I'm going to prove that to you. So our objective is basically to understand the impact of violence, particularly for youth. We're going to discuss the progress that we have made, and yes, there's been major progress in 24. But now, what's the current political concerns today? And then we're going to learn some strategies and grassroots efforts that our council is actually doing. And so, just to show you guys where we are and that we didn't just get here today, this just shows you where we have been over time if you compare us to other countries. This is the healthcare disparity that we see, where we have these many black people dying as opposed to white people from gun violence. It's been there. We've been in this space. And to show you how we look when we compare to other countries in terms of our kids who are dying and how we exceed every other country. And so the pundits will tell you that all these shooters are crazy. Well, we all know that's not the case. People who have mental health illness kill who? Themselves. They're not even thinking about trying to kill the next man. Now, you may have about 3 to 4% who may have actual, mental illness that will do some things, but the majority of these shooters just lack mental wellness, coping skills, anger management. They're angry, and then they have access. And so the majority of people die from guns, from suicide. And so this is just showing you where we are in terms of how suicide far exceeds homicide. And it shows you what happened in 2020 when COVID hit and how everything went up exponentially for homicide. And so it also shows you that suicide kind of plateaued off. And the good news is, some things have happened. Between that time span and now, we saw a decrease. And that's good news. And that's also the suicide. That's good news. And we'll talk about why that happened shortly. We all know that it's expensive. We spend a lot of money on trauma and the rehab process and the social, mental strains, issues that causes. And so a lot of funds are being spent, and it far exceeds any other medical condition. In terms of healthcare disparities, it seems like every infliction in life happens to one race, black people. So we have so many issues that we all could have to discuss. But right now, the big public health problem for our youth is, can I live to get to college? Not can I be a doctor, which we already know there's a shortage, or a lawyer. These kids are worried about, am I going to graduate and live to see my 21st birthday? This is on the mind of all these kids. And it's the leading cause of death for black children and teens. In fact, we all should know that now this has changed. It's not 10 to 24. It's 10 to 36. It's the number one reason for why black men are dying is from homicide. It's also the second leading cause of death for Hispanics in that same age range of 10 to 36. And so I always show this, right? We all think that a lot of these people are being killed from gun gun violence secondary to gangs, robbery. It does happen, but consistently over the years, FBI homicide data, number one, is showing black people die, black men die at a rate way higher than whites. Most of them are male. Women are dying as well. Most of them are killed by somebody they know. So we got to tell our kids, watch who you hang with. That could be the next person who's going to end your life or have you getting shot. But then they also looked at, why is this happening? And so I followed this for the past 6 or 7 years, and it's always the number one reason is altercations. People are angry, they're pissed, and then they have a gun. And so things happen that should happen. And so looking at black data for black women, well, it's the number one health issue facing black women. Am I going to be killed by the man who I think I love? It's happening on every level. Teenagers, young adults, it's happening. And they're also being killed by people they know and being killed with guns. And so looking at why this happens, the pundits will blame it on the family, that the father and mother are not there, they're not structured. But it's the whole plethora of reasons. From an individual standpoint, how are they been dealing with psychologically? Is there alcohol and substance abuse on board? Is there a history? What's the parental practices? Is there discord? Did the kid, mother, die in COVID? Did the grandmother who was keeping Johnny on a leash die in COVID and could not bury that grandmother? So now they walk around just angry. You got to think about all of that. And then what's the community? What's their responsibility? Are they at a high crime level because of the social determinants of health? Can they afford to eat? Do they have to go and sell drugs to feed their family? We don't think about these things. And then societal, what's happening here? What's the weak economic safety nets? What's the poor rule of law? So these are all reasons of why it's such a problem. And then there's a cycle. Once these kids see violence, they're more inclined to do violence. We have to break that. Youth violence, well, we already know it's increased across all these spectrums. Mental health has increased since COVID. It's a lot of isolation that's still happening. These kids are trying to express themselves. And then now we have social media, a big inciter of violence, causing a lot of problems. And then we have these communities being affected, not just urban, it's happening in suburban areas as well. That's why people are now starting to take notice. So these are the social determinants of health. This is just showing you where we are in more details by why the social determinants of health are so important. These are things that we need to change, and we'll figure out later how to change that. It's a process. And so this striking headline happened in 2022. New England Journal of Medicine saw that, hey, it's not just black and brown kids being killed, it's every kid being killed now. It's the number one leading cause of death, guns, for all kids now. And also, those same kids are being killed not just from homicide, but from suicide or unintentional injuries. And so just moving forward, you see the actual graph showing that we first exceeded motor vehicle crashes, and firearms is where we are now. So finishing up, I just want to show you this, right? This is showing you the progress that has been made in 21, 22, 23. Gun violence was going up, and then now in 23 it went down. And now I just added this recently in 24, it went down by about 25%. In terms of injuries from guns, it went down. In terms of our youth, this is where it gets striking. If you look at youth, you look where the numbers have actually gone up. Fighting went down a little bit in 24 for kids 0 to 11. You look at teens, 12 to 17, it was going up. While everything else for overall was going down. It was still going up. And we finally went down a little bit. But what's concerning about this is only age 0 to 17. So my epidemiology background is telling me that there's a whole cohort that are missing. And that data is not being included. And so this is inaccurate. So a bunch of 18 and 19-year-old young people are dying that we're not even accounting for. And then even mass shootings were going up, going up. These are 4 more people shot that's not the shooter, actually went down. And then suicide, still around the same, 27,000. And so the next epidemic is kids. There are over 4.6 million guns in homes. And every day, 8 kids are being killed from guns that they find from these homes. This is just showing you multiple different youth who've gotten killed over time in multiple cities where they found a parent or a family member's gun. This is our next epidemic of kids 7 and under who are dying from people like you and me. I would ask the question, how many of you guys have guns? And then I would ask the question, how many of you guys are locking your guns up? I think you guys should do that. Because you don't know if your nephew is coming over, and now you forget that you left that gun unlocked, and now they get that gun. You can't come back from that. And so we got to protect our kids and not these guys. And so moving forward, let's go and figure out what progress did we make. Greg is not here, but he sent this video.
Greetings everybody at NMA. This is Greg Jackson here, survivor of gun violence, but also the former deputy director for the White House Office of Gun Violence Prevention. I'm sorry I couldn't be there with you in person today, but wanted to share just a few minutes about our work, the progress we're seeing, and really contribute to this really important conversation. So as you know, gun violence has been a major public health crisis in our country. It's now the #1 cause of death for youth in America, the #1 cause of death for black men under 44, the leading cause of newly disabled Americans, and most recently has been deemed the leading cause of maternal death, and really death of pregnant women in America ahead of childbirth complications. And despite all of these major challenges, we know that the trauma and the pain of this crisis ripples way beyond those who are directly shot or injured. When I was shot in April 2013, I'll never forget the feeling of my life potentially being over, but also seeing the trauma that it had on my family directly and all of my loved ones. And so we know that the pain of this crisis bellows way beyond those who are in the hospital room. But in the last few years, we have seen a great deal of progress, believe it or not. The last year, we saw a 14% reduction in homicides. That's double the national record for homicide reduction. The year before that, we saw 11% decline. And in total, the last 3 years have yielded a 31% reduction in homicides in America. Now, unfortunately, suicides have held steady, but these reductions, we know, have saved thousands of lives. But how did this happen? Well, frankly, it's very easy to see. There were two major things that have happened over the past few years that have deemed this tremendous reduction in homicides. One, led by the Biden-Harris administration, we saw historic resources invested in violence prevention and intervention strategies. In total, around $42 billion have gone into things like victim services, community violence intervention programs, school safety programs, resources to improve learning environments, the largest investment in mental health in American history, creating programs like 911, adding 14,000 school-based mental health professionals, and even investments in law enforcement to implement life-saving strategies like the red flag laws, like prohibiting and removing firearms from domestic abusers. But these billions of dollars went directly into evidence-based strategies to reduce violence throughout the country. We also saw major policy change. The Biden administration actually moved forward 54 executive actions, and in 2022, the first law to address gun violence in nearly 30 years was passed, the bipartisan Safer Communities Act. And in this bill and in these executive actions, some major things happened. We made gun trafficking a federal offense for the first time. We actually made sure that domestic abusers that are dating partners are now prohibited from buying firearms. We made sure that those who are under 21, that we also look at their mental health records and their juvenile criminal history to decide whether or not they can be approved to buy a firearm. And we also clarify what it means to be engaging in the business of selling firearms, ensuring that those who are selling guns online, at gun shows, and other means, that they are obeying the same laws and regulations as licensed gun dealers throughout the country. So these major policy changes had a clear impact across the country. And again, I shared that 31% reduction, but in 2023, we actually saw the steepest declines in our inner cities, specifically cities with over 1 million residents. We saw the average decline of 40%. Places like Baltimore have seen double-digit reductions for now multiple years in a row. Boston, Massachusetts saw an 82% reduction. Miami has now reached the lowest levels of gun violence since the 60s. And so major cities have seen the most progress in reducing violence, and we know that that is a direct result of these investments to cities, as well as many states implementing strong gun laws to complement the federal laws later. But with that said, these resources and policies are under siege. We know that the current administration wants to make major slashes to budgets across agencies, and we're afraid that those cuts will impact some of these life-saving dollars. And we do know there are direct attacks on the infrastructure agencies at the federal level that we know have played a huge role. For example, the ATF, that is our federal law enforcement arm to implement and enforce the gun trafficking law, to enforce ensuring that gun dealers are obeying the law, that enforce efforts to hold the gun industry accountable. And so not having that agency or having it merged or dismantled can have a huge impact on our federal law enforcement ability to keep guns out of the hands of those who are most vulnerable and at risk. And also, frankly, shutting down places like the Department of Education, because we know there are multiple programs and resources aimed directly at youth violence reduction that live within the Department of Education, including Project Prevent, that provides resources directly to elementary age youth that are experiencing trauma from law.
So guys, we're gonna move forward. He went over his 5 minutes. Gave a lot of important information though, but we gotta be on time because we already lost a little bit of time. So next up is Congresswoman Dr. Robin Kelly. She's gonna present at the podium.
Good morning, everyone, and thank you so much for inviting me. I really appreciate it. And I just wanted to say, I listened to Dr. Benjamin, and he is completely on point. So don't forget what he has said, because it's so very important. And I just want to thank Dr. McGee. It's an honor to work with you again. He puts me to work a lot. But your work, Dr. McGee, makes a real difference in our communities, makes them safer and healthier. And I'm also glad to share the stage with gun violence prevention advocates, Dr. Swann and Mannone Butler. I'm honored to be on the stage with you. We all come to the table with different perspectives and knowledge, because solving gun violence will truly take all of us and you. We need to attack this issue from every angle to save lives. So I'm looking forward to hearing what my fellow panelists have to say. I know all of us in this room understand that gun violence is a public health crisis, but there are some groups, like the gun lobby, that tell doctors and healthcare professionals, you've heard it, to stay in your lane. Saving lives is your lane. When gun violence costs $2.8 billion in medical costs, that is a public health crisis. When someone survives a gunshot wound, they're more likely to get shot again. That is a public health crisis. When over 45,000 Americans die due to gun violence every year, that is a public health crisis. So we are exactly where we need to be, or you are exactly where you need to be. And I want to thank the National Medical Association for your dedication to advancing health equity. As chair of the Congressional Black Caucus Health Brain Trust, I've partnered with you on many occasions in good pieces of legislation that will close health disparities for Black communities. This panel on gun violence prevention aligns with the NMA's mission, and we refuse to let the gun lobby tell us what to do. As you've heard, we've celebrated real progress. In 2021, every year since, I led House members in creating and providing funding for the Community Violence Intervention and Preventative Initiatives, a grant program under the DOJ. This program provides CDI funding and was allocated $100 million in fiscal year 2022 and 2023. Then Congress passed, as you've heard, the first federal gun safety legislation in nearly 30 years, the Bipartisan Safer Communities Act. It added another $250 million over 5 years for community violence intervention programs. As we travel the path forward, I think it's important to look back on these successes to remind ourselves that we can do and will do good work. We've also been in tough spots before, and we need to keep moving. I'm not going to sugarcoat it. The path forward under this administration and with the Republicans in the majority will be difficult. Honestly, I feel like I'm fighting some days with one hand, some days with two hands behind my back, but I'll keep kicking. We aren't even 100 days into a second term, and we've already seen him attack gun safety. During Trump's first term, gun homicides rose 34%, excuse me. It seems he is determined to drag us backwards again. And, as you've heard, less than 24 hours in the Oval Office, Trump closed the White House Office of Gun Violence Prevention. He signed an executive order demanding a review of gun safety policies to see if they violate the Second Amendment. We all know that gun safety laws don't contradict the Second Amendment. Gun safety laws allow people to own guns responsibly so they are no longer in danger to themselves or others. I led a letter with Representative Maxwell Frost and 67 other colleagues to President Trump demanding that he reopen the White House Office of Gun Violence Prevention. And actually, Rep. Frost and Senator Murphy did file legislation again to open the office. Greg Jackson, as you won't be able to make it to the panel, but we held a press conference with him and CBI leaders from 22 other cities to highlight their life-saving work. And last night, I was on a panel with Johns Hopkins University, another healthcare organization dedicated to saving lives from gun violence, and the doctor that spoke also was a victim of gun violence. He was shot in the neck at 17, and other doctors saved his life. So what I was thinking last night, suppose his life wasn't saved, and here he's an award-winning doctor now because of the work of other doctors. I'm proud of what we have done. I'm just going to tell you, we have to keep the faith. We cannot stay on the sidelines. As I said, we're fighting with one or two hands behind our back. We need everybody in the fight with us. We need the advocacy, and I dare say we need the agitation, because our lives depend on it, quite frankly. So I want to thank you all for having me again, and I look forward to the conversation.
Thank you so much. That was awesome. Next up is Dr. Swann.
Good morning, everyone. Well, it's hard to come behind these two because they've covered everything I had in my notes, okay? And so we're going to just have a conversation about how gun violence, the fact that it's a crisis here in the United States, a public health emergency, which we all know, I'm speaking to the choir on this, and it has steadily, over a period of time, it worsened, and now we're hearing that there's some improvement. And so we want to applaud that improvement and hope that we continue to see that as it moves along. I would say from my perspective, the MD, JD advocacy side, putting it all together, I have struggled with the complex layers of gun violence. I think that if we think about how it extends beyond the immediate physical harm, we can't afford to approach gun violence from a very narrow perspective. We have to have a viewpoint that is comprehensive, that's intersectional, that incorporates the expertise of the medical community, the legal community, and the frontline community, if in fact we're going to make a change. We know that health consequences of gun violence are vast and complex. You're medical professionals, we all know that. And as medical professionals, we're deeply aware of the toll it takes on our healthcare systems, on individual lives, on the families, and across just an overwhelmed community. The aftermath of gun violence is significant. The traumatic injuries that last a lifetime, that it impacts our communities in many ways that I don't think sometimes we're considering, because I was at one point the general counsel of the National Education Association. And so therefore I'm very much aware of the impact on children, but on educators who have to deal with the children who come in that are either traumatized by what's happened to parents, or traumatized themselves because they've been shot, or they've seen classmates shot on the way to school. There are so many different segments and segues and intersections around what gun violence means and the impact. And it's crucial to recognize that gun violence is not just that individual issue. but it's a public health crisis that demands this coordinated response. And I do happen to believe that physicians witness the devastating impact of gun violence firsthand and have an ethical responsibility to advocate for proactive policies. I think whether through patient education, hospital-based intervention programs, legislative testimony, which we know how significant that is, doctors must leverage their credibility to push data-backed reforms, such as safe storage laws, background checks, and other things. From the legal perspective, however, there's a responsibility to advocate for comprehensive laws that regulate firearms while ensuring public safety. This includes advocating for universal background checks, imposing restrictions on assault weapons, and initiating high-capacity magazines and all measures that would significantly reduce gun violence. However, I think we must recognize that legal challenges that arise when we attempt to regulate gun violence, they are significant. The strong resistance from pro-gun advocacy groups and their influence on lawmakers can make it difficult to pass meaningful legislation. Legal professionals are also charged with ensuring accountability. And in this context, I would say that we have a lot to do and a lot of work to do in that area to work with the medical community to ensure that we are doing a concerted, consolidated, intersection approach. And I think that amid these legal and medical discussion, there exists a cultural narrative. And this is the one thing that I do think we're going to have a large conversation around, this cultural narrative that has to come into play as we talk about the links of gun violence to hip hop. And I am here in the role that I serve with the Hip Hop Caucus. And so I'm bringing that to the table because that is a large discussion. Most critics point to the violent imagery in hip hop lyrics, the depictions of murder, street warfare, retaliation, and claim that these messages contribute directly to the real world violence. And this cannot be denied completely. However, we cannot solely blame hip hop for the violence, and that would be to ignore the broader systemic issues that are impacting the broader pieces of our community, the broader sections and intersections of our community. The true drivers of gun violence are not found in the music. They are found in the structural failures that have created environments where violence is seen as a means of survival. So we have to keep in mind that hip hop is over 50 years old, and its relationship with violence is not as simple as critics suggest. It was not born out of a desire to glorify destruction. Instead, it was created as a response to it. Hip hop emerged in the Bronx in the 1970s during an era of urban decay, rising crime and police brutality, and in a city that had all but abandoned entire neighborhoods. Young Black and brown youth found in hip hop a way out. But we do have to acknowledge that hip hop has had a significant impact on violence. Hip hop, though, has always been more than entertainment. It's been a tool for activism, a platform for marginalized voices, and a means of social commentary. And so I think we have to keep in mind that we have iconic figures that have been in hip hop. I mean, Tupac Shakur would be one, and so many more. And we also have to keep in mind the fact that if we're going to talk about hip hop, we have to think of it as a global movement. And it could not have become a global movement if it's all bad. I think that we have to think about from Johannesburg to Tokyo, from London to Rio de Janeiro, hip hop has become a voice of resistance, a language of struggle, and of triumph. And so we do have to ask ourselves if in France, hip hop artists use their music to expose police brutality and racial injustice. In Brazil, rappers are using hip hop as their approach to the highest government neglect and systemic injustice. Or in Japan, where the hip hop culture has become a powerful platform for youth rebellion and political activation, we have to ask the question, if hip hop were truly the root of gun violence, why do countries like Japan, France, Brazil, where hip hop thrives, why don't they have the same issues that we have in terms of gun-related deaths here in the United States? And so I think that we have to acknowledge that the root of the issue is in policy. Are we doing what we have to do in order to ensure that the policies are in place? And in that, we have to make sure that those hip-hop performers and artists have to start to own up to the role they play. But also we need to embrace those who have done better. When we think about Cong, Killer Mike, T.I. and others. And you can tell by how old I am. I don't know half of these folks, but I do know, that they said that they were doing better. And so I'm going to, I know that I have a 5-minute limit as well. I'm going to move on and give us an opportunity to kind of take some of this in while understanding that I just want to finally say that for Dr. McGee and incoming President Dr. Mitchell, I just want and pray that they continue all of this insightful work that they're doing around this. And I look forward to the questions that I'm sure are going to come my way. Thank you.
Thank you so much. That was Iron Wickman. Next up is Mannone Butler.
First and foremost, thank you for the invitation to be a part of this august panel in this really incredibly important conversation. Mannone Butler, Head of Programs and Partnerships for the National Basketball Social Justice Coalition. The coalition was established in 2020. We were actually established in the wake of the tragic murder of George Floyd, and quite frankly, far too many other deaths in our country. And it was actually established we're established as a joint venture of the League, the Players Association, and the Coaches Association. I come to you today on the heels of this information, so check you have the data, right? Check you understand the policies, right? Check we also understand and we've heard that firsthand about the personal impact that gun violence has had and have on our lives. I also want to just share, though, that we all have a role to play. So that's been also a point that's kind of been echoed throughout the comments that you've heard so far. That includes the National Basketball Association, our community. We have the coalition has 4 priority areas. Again, we are the policy advocacy arm of the NBA community. Our issues are criminal justice reform, policing, voting rights, and our frame for gun violence prevention is community safety. We are a big tent. We have 30 teams in 28 markets. And so community safety serves as the umbrella to really support and uplift this very notion of ensuring that the communities within which our teams play are okay. It's really pretty simple. We are really clear that basketball unites. It's an opportunity to bring folks together. How many in here are NBA fans? If you're not raising your hand, anyway. Okay, all right. We understand it brings us together. We also understand that we have strange bedfellows that come together to enjoy the art that happens on the court, and it's important for us to use that platform off the court to delve into the issues that impact us all. Again, you heard the stats, right? So, and I'm a native Washingtonian, and I grew up in the era when gun violence was rampant in the city, so personally I understand it. Professionally, prior to joining the coalition a few years ago, I led the Criminal Justice Coordinating Council, an independent agency in DC, so I understand it professionally. But now we have the platform that the NBA provides to shine a light on this critical issue. We have teams across the market that lean in different ways. Just this year, the 76ers, in partnership with Penn Medicine, launched 76 Assist Safe Communities. And literally, there are novel ways teams can lean in. And it literally is, for each assist, $76 is donated to communities, those community organizations that are doing the work, right? So I want to make it really plain. A couple of years ago, the Toronto Raptors, we have one team that's not the States, but I have to give a shout out to our Raptors because they led the charge. They led a petition to establish a gun violence awareness day, a la what we have in the States. And so in 2023, I was pleased to be able to be a part of the ceremony where they, alongside the Prime Minister at the time, Trudeau, actually launched this special day, the Gun Violence Awareness Day in Toronto, Canada. So our teams understand the platforms that they have. And our goal and our responsibility is to provide support and, quite frankly, uplift the mega platforms that our teams have, and actually to also support them as they're leaning into the issues that make sense. Community safety is one such example. The last thing I'll note is one of the first things that we did in 2022, the summer of 2022, was to convene a conversation with Monumental Sports and Entertainment. And that was with a couple of our players, organizations that are doing the work on the ground all day, every day, to ensure that communities are safe, and also mothers who lost their sons to gun violence. And so why was that important? We also understand that the light, quite frankly, the attention that NBA can provide and bring to issues. And so that conversation opened the door in a way that was incredibly important. And more to come. So I'm thrilled to be a part of this conversation. Look forward to the conversation and the questions that will flow. And I also just want to close with saying a thank you to the National Medical Association for the trails that you've blazed, the trail that you are blazing and will blaze, and pleased to be a part of the process. The NBA and our Social Justice Coalition is pleased to be a part of the process for social justice. Thank you.
Guys, clap it up for our wonderful officers. They did a fantastic job. So I'm going to open up for a few questions for about the next 10 minutes. Anybody have any going questions with that? Of course, Dr. Gang.
Good morning.
Here's a mic coming for you, Dr. Gang.
Good morning. I'm Shivado Gang, President of NMA. And Congressman Kelly, can you speak to the ghost guns, the issue that we're experiencing right now in regards to the deregulation of ghost guns?
Well, actually, the
And
Supreme
speak to
Court,
what ghost guns are. I heard that
Sorry.
question.
you can order different parts from online and then put a gun together so it has no serial number, it can't be traced or anything like that, which is a problem when it comes to crime. But the Supreme Court just upheld Joe Biden or the Biden-Harris administration's law on ghost guns. I can't quote it to you exactly, but it was good that they held it up and that it'll make it harder for criminals and people that are trying to use ghost guns. I don't have the information right in front of me, but it's a good thing, what happened. And it was 7-2. But as our leader, Hakeem Jeffries, always says that we know there's always going to be 2 people against us, Clarence Thomas and Alito, 3 people for us, and then the other 4 we can maybe maneuver sometimes or convince, and they were convinced. So 7-2, they upheld what Biden wanted to do on ghost guns, which will protect us more. But they are very, very dangerous.
Thank you. Next person. Yes. Say your name and your profession and ask your question.
Camille Clare from the great state of New York, and I'm an obstetrician gynecologist. Thank you, Congresswoman Kelly. So happy to see you in the room. Can you speak to the intersection of gun violence and the impact on maternal mortality and morbidity in pregnant and birthing persons? I know you've done so much work for us and with us, so we're so thankful and happy to always see you.
And I'm a native New Yorker.
Yes.
That's what I told Dr. McGee. I do more than guns. But I've done a lot of work around maternal mortality and morbidity, and thank the people in the audience that have helped us do the things that we've been able to accomplish. But the thing with guns, more women, period, lose their lives to gun violence, but pregnant women, as you've heard, I think, lose their lives even more. So it's very dangerous for a woman to be pregnant, and more dangerous that she'll lose her life or be maimed because of gun violence than even the maternal mortality and morbidity problem. And that's why we were glad to see legislation passed, not only for the person you're married to, but also it could be who you were never married to, but your partner, because that was a gap in the law.
Awesome. Thank you. Yes, right over here to the right, and then we'll take the young person right there.
Good morning. Thank you for the great presentations and the data. I do work in climate change, and there's a lot of new studies showing the relationship with heat and interpersonal violence, and the altercation data is very compelling with what we're seeing with heat, especially indoor heat temperatures, in mood changes and interpersonal violence, which then leads. And unfortunately, with our current administration on climate change, I don't know what do you see we could do to really bring awareness of what your environmental temperature, indoor temperatures, does to mood, which then may lead to altercations?
Well, I think statistics show, period, I'll just go to Chicago, as it gets hotter, period, there's more gun violence, but also there's more people in the street, and, so I'm sure that, is a part of it too. Don't count on this administration for anything, for any movement environmentally, unless, I didn't say this, but we could stop a lot of things if 3 brave Republicans stand up. We are so tight in the votes. Yeah. And actually the only reason we're not in the majority is because North Carolina gerrymandered 3 of our colleagues. They took their districts away. But if we have 215 and we would have had those 3 people, then we would have had 218. So, but unfortunately, we just lost 2 members, so we would have flipped right during this time. But I think just period, the statistics show, the hotter it is, the worse gun violence is. But then, on the other hand, there are states that are always hot. So there's other things that, as was said, there's other root causes, of the problem, but that is an issue also.
I'm going to ask you a question. Once he's done, I have 2 questions for each of the other panelists.
Glenn McWilliams, Great State of New York. I'm a urologist, but that matters. But is there any sort of correlation between the legalization of marijuana and the increased use of more violence or less gun violence?
I'll let one of our panelists answer that question. Any association between cannabis use and increase in violence?
I don't believe that we have any data that specifically correlates that at this time, but I do think that we are beginning to notice that with the increased cannabis, the availability, the openness, you can get it almost on any corner in our communities. It's becoming as prevalent as a liquor store on the corner almost. I think we're beginning to see that, yes, we are anticipating that we will see that correlation, but we don't have data to support it at this time.
If I could just say, the bottom line is also the access to guns. 95% of the crime problems come from 5% of the gun stores in the United States. In my district, I had the famous Chucks, and there's 4 gun shops in Illinois that could account for most of the crime, and I'm proud to say they were finally closed down.
Awesome. Just to add to that, cannabis more relaxes you is not really known, but a new study came out showed that there's a 7 times more risk of having cardiovascular disease with using cannabis, which I was very surprised about. But yes, sympathomimetics, cocaine, amphetamines, meth, those are more inclined to get you agitated and promote more violence. All right. So I have a question for Mannone Butler. Tell us about the ways the NBA, Social Justice Coalition, partners with organizations to advance issues that you discuss in community safety.
So let me just say this. Our major areas of focus are, I noted before, criminal justice, voting rights, policing, and community safety. We focus on using the platform to advance policies at the federal, state, and local levels. And we really are clear that the work is happening at the local level. There are organizations that are blazing the trail, but more importantly, doing the work. And so with each of our issues, we have hundreds of measures that we monitor, and those measures actually are tied to organizations that are doing the work. So the National Institute of Criminal Justice Reform, we work really closely with. Everytown, we work with. We certainly work with Giffords. So all of these organizations at who have a national profile, we work with, but we are very clear about the role, the local reality of gun violence, right? And the local reality means also local solutions and local actors that understand community certainly far better than we do kind of from a national perspective. So it's really critically important for us to join forces with organizations that are on the ground. I'm in DC on the board of Peace for DC, which is a local organization focused on community violence intervention. And the work that's done is we use the platform, we're making sure that we are using social, for example, to help amplify the good work and, quite frankly, the best practices. We appreciate our fan base, and we appreciate the fact that we have a reach, and our teams have reaches, and that our teams can get out messaging and messages in a way that is another kind of tool in the toolbox to communicate the importance of community safety. We also certainly see ourselves that we have the ability to uplift and to amplify, but we also understand we have the ability to convene. So our convening power is something we certainly don't shy away from. It is an opportunity to work with those organizations that are on the ground. I will use this, share one example that is somewhat connected. We are also focusing on second chances. And the issue around second chances is, as we're getting ready to enter April, Second Chance Month is near and dear to kind of the work that we do. We have partnered with our teams, most recently with the Utah Jazz, to host an expungement clinic, which is not mutually exclusive from the conversation we're having right now. And we did this in January. 2,300 Utahns showed up to now get on the road to getting their records cleared. And that is really critically important. So when we think about kind of the holistic way we use the platform and we leverage the platform for the issues, our social justice issues, we lean into our ability to convene, but doing it in concert with the organizations on the ground that know the communities, that have worked for the communities, and quite frankly, that could benefit from the lift that we know the NBA has to offer.
Awesome.
So you can get more specifically with the
So I got to cut you off for a second. I got a question over here. This is going to be the last question. Then I have one question for you. Then we're going to proceed. Then we're going to open up again at the end. So 30-second question, 30-second answer.
Thank you. Melanie Hannah Johnson, Detroit, Michigan, Wayne State University School of Medicine internist and Speaker of the House of Delegates. My question is regarding that emphasis on the cities and local impact. Our Mayor Duggan spoke on the gun violence and sectors and having mentors embedded. Is that a federal initiative? When those dollars go, will it impact what's happening in the city of Detroit? We have a tremendous drop in crime and gun violence because of that.
Who was your question to?
All three, but probably
Only one.
okay to J.D. Butler, Mannone Butler.
I would say this, we work with the Pistons, and we certainly understand that the commitment that the mayor's had. We actually did an expungement summit in partnership with the Pistons. I would submit, and I would actually think that Representative Kelly can speak with more precision about the federal, kind of impact of the federal dollars, but we understand across the board that when the dollars are drying up, that's going to have implications in terms of the resources that have been brought to bear and leveraged in our community.
Is it too late to course correct?
I mean, the dollars have been very, very important. The thing about the community violence intervention programs, it goes to the people on the ground that know the community, know the work, survivors themselves, or victims themselves. And but if the money dries up, it'll be tough as was said, to carry the programs on. But some of the money's already obligated, they just can't claw back the money. But as we're doing appropriations, they may not put more money into it, which is a problem.
Let me just say this also, though, real quickly, that we also know that there are community members that have been doing this work way before the resources were dispersed, and they're going to continue to do it. We also, though, just know the critical importance of having the resources to expand the work, and that's in keeping with the need.
That's awesome. So guys, I got a last question for Dr. Swann, and I'm surprised you guys didn't raise an uproar about hip hop and his role in gun violence. And she explained a lot. She put a lot of myths to rest. I was going to ask that question, but I'll go ahead and defer my question to who's going to ask that. Go ahead.
My question was really about how do we lean into hip hop, and how do we begin, if they're using the music anyway, how do we empower the youth to partner with us on this kind of panel? I think a lot of the youth feel like we tell them what to do, and so it becomes very paternalistic. And this generation, I can say a lot of things, but that sort of rebellion against authority. So telling them what to do as opposed to empowering them to partner with us for solutions in this youth violence, particularly from the hip hop perspective.
And the same thing on that, how do these artists become credible messengers in preventing violence and joining us in what we're trying to do? Same question, I think.
Okay, I think that it's going to be very important to understand that I think it's almost two questions here, because when we're talking about the youth, we are talking about how do we engage with them in a way that my recent experience has shown me that you have to show them that they're telling you as opposed to you telling them. And so I think it becomes important to have them to understand that there's access for them to engage with influencers, because those are the ones that are going to encourage them to become involved, to engage with the influencers that are saying the positive messages, and to also coordinate and connect with groups like, obviously, the Hip Hop Caucus Education Fund, which is where I'm working, but also with other groups that are within their neighborhoods, within their school systems, that would be more engaged with that work. And the broader question is,
how can we partner with hip-hop artists for them to become credible messengers?
Hip-hop artists are a group of individuals who actually want to get the message out. They just need to figure out who they can talk with, who they can speak with, that would actually help them do that. There are a number of artists now who have seen the danger of what has happened over time, and they're trying to reverse that danger. And they're wanting to have the opportunity. The National Medical Association would be a key group that they would work with. Obviously, they work with the Hip Hop Caucus. They would work with others as well. Obviously, the National Basketball Association. They would look for ways to work with members of Congress.
One
and
of my colleagues does something every year, Andre Carson.
Rev Carson and I, we know each other and work on the hip hop at the CPC, the hip hop panel there all the time. And so there are different ways to get hip hop artists involved, and you, as long as you have a connection to be able to say to them, come here and let us give you a platform, then they will allow themselves to be available for that platform. And more are beginning to want to be engaged on the positive side, because they do see what the negative side has done.
And Dr. Swann, that's why you and Mannone are up here. We're about to start this partnership right now. And so you guys laugh at that, right? But right now, we already hear funds are gone. Let's just act like funds are not there. So how do we keep this great work going where we saw this decline in gun violence and now spread it to our youth? We're dying. We can't get more doctors if they're dying. So what can we do without putting a lot of money invested to let them see the light? Because it got to come from them. So let's go through that real quick. In 3 minutes, I want to show you some solutions. So first off, shooters are not just the kids from the low socioeconomic status neighborhoods. It's any and everyone. Because they got your gun that you leave it unlocked. Okay? So think about that. So these kids that want to kill somebody, they will find a way to kill somebody. That kids have been bullied for 2 years in a row may find that gun one day and say, look, I'm tired of these kids at this school and go and shoot everybody. That's why we're having all these mass shootings. So now, if you look at the social determinants of health, well, how do you change social determinants of health? Well, you got to change the political determinants of health. You got to choose the right government. You got to make sure your policies that you want to be changed are there, and then you got to vote like you never voted before. We just learned that we're not doing the right things. Else we would not be in a situation with this particular president. So we got to do better. So that's first and foremost. And then looking at what else is everyone doing? Well, I attended the American College of Surgeons Committee on Trauma. We had everyone there, from pediatrics to psychiatry to trauma surgeons to internal medicine. And they all came up with the same thing. Let's increase research. Let's do these federal checks. Let's prevent child access laws. Let's educate the community about safe firearm storage. Let's partner with law enforcement. Let's educate our providers and our students on trauma-informed consent. And Robin has to go thank her for she stayed over from yesterday to be here, so thank her again. Thank you so much. And then we have developed best practices for youth violence prevention and engagement for our youth. And so we also went to the AMA conference, and they basically said the same thing that the American College of Surgeons said in terms of strategy. And so now our committee came up with our strategy and our action items. Please take a picture of that. Because this is what we're doing. We want to be at the table with the leaders in Congress. We want to work with NOBLE, the National Organization of Black Law Execs. We want to work with ASAP to promote safe gun storage. I introduced 2 resolutions to ASAP, as well as to NMA, on physicians becoming credible messengers to patients about gun safety. And that could be in the form of that business card you have on your table. It could be that QR code. Pick that business card up. There's one for everyone. We can have something like that to give to our patients when they come to our office. Your triage nurse simply asks, hey, do you have access to a firearm? Please take this card to protect your child. And it's not that particular card, but it would be a card that has a QR code telling them about the dangers of gun violence and not having safe gun storage. Also tell them how to go and buy a gun lock at a discounted price with some manufacturers. Also having a video teaching them how to stop the bleed. Also having those statistics showing all these kids dying across America after getting a gun that was left out. So that card could be changed to what I just said. And so also, what about our medical students? Let's teach them stop the bleeding. Let them go out and teach the community around them how to stop the bleeding. Let's also teach them CPR and trauma-informed care. And then let's determine the best practice. What's working out there? And let's do it. Okay? And so, how do we engage youth? Let's find a way. You get their attention by getting their attention. Whatever it takes. If it's hip-hop, so be it. If it's the NBA player who had a gun, John Morant, let him do a commercial. Say, hey, let's not do what I did. Let's not make that mistake. So that's how we get these guys and our youth to now take notice. Let's be in their space. Because they're not coming to our space. And then, let's create a meeting of the minds. Once we figure out what to do, let's get all the organizations that work with you, and let's all do the same thing. Let's do the same thing. Let's follow a calendar of events. By the way, on your table is a calendar of events. Please pick that up. Everybody should have one. It's on the back of that QR code. Look at that. So this is the calendar of events from Students Against Violence Everywhere, which is also the Saving Hood Promise. They have a calendar of events for the whole year, right? So for instance, April 28th through the May 2nd is National Youth Violence Prevention Week. We're doing multiple things in Chicago, which is on that little flyer you have. We're going from school to school. We're taking motivational speakers. We're taking black law enforcement. We're taking hip-hop artists. We're taking DJs from the radio that they listen to. We're going to get their attention, then we're going to drop the message. We're also partnering with Sandy Hook, where we now have these kids to get trained how to become credible messengers in their schools to prevent violence. Also about say something. When they see a gun or see a kid that's about to kill themselves or shoot up the school, say something. You're not a snitch because you're saving a life. You're not trying to get some kind of gain. Snitches get gain. They get out of jail for, less of a sentence. As a person who's trying to save a life, that's not a snitch. So let's figure that out. And then let this meeting of the minds come together where now we farm out all that information to these organizations like Boys and Girls, 100 Black Men of America, Church Youth Group, D9 Brothers and Sisters, Obama's My Brother's Keeper, So we can get them to now follow the same thing, same calendar events. For instance, June 6th, we're Orange Day. Why can't we get all these schools, the police, and the hospitals to now have a march that organized by NMA that now the media picks up, and now the kids are seeing, damn, they really do care about us. Because the kids are not seeing it. They're seeing the glorification of gun violence. They're not seeing solutions. So we can offer that. NMA can be the leader for that. So let's work on that. And that's our goal, is to do that. And then we don't have money. So we got to partner with somebody that got money. You know, whether it be the NBA, the NFL, whomever, pharma. They have a moral responsibility to prevent the madness that's going on out there. And now funds are being lost everywhere. The NIH grants are not happening. So we got to do something simple, but yet powerful. And this is the easiest way to do that. So a few examples. We're talking with everyone. We're getting all the right people in Congress. We're going to have, you know, our past president of Noble, Brenda Goss, who came up with the idea about SMART, which is an acronym for locking your guns up and talking to your kids about, if you go to your brother's house, if they have a gun, to what not do. Don't look at it, don't play with it, don't point it, and don't use it. And tell somebody. Kids need to know that across the globe, because they don't know. They think it's something to play with. That's what I'm seeing. Last year, 4 kids come to my hospital that we had to take care of who were 5 and under, either shot, killed, or injured, because they got shot by their little brother or by themselves. This can't be happening. And it is. And that's the next epidemic. So let's partner with the Black Information Network, who's already doing this, who's already spread that message about locking it and storing it. That's hip hop at its finest. Let's work on these social skills and things that need to be done. This is what I presented at ASAP. They made a card for everyone to get, and they talked about these statistics about Black death and what's happening to our youth. Let's do this all across the globe at every conference, at regional conference. We can do that. Let's have that QR code. Was that QR code on your table? Pick up that QR code that's on your table, guys. That's an 11-minute video showing any and everyone how to learn how to stop the bleed using tools you have in your own home. We put that together with Cynthia her promise. We give that to all our kids that we can interact with. And they also get that business card that has all this information. Well, these are some other things that we're doing. We're partnering with the police department. We do car shows. Letting kids know that you can, you know, trust the police. We're doing things for Mother's Day, saying, hey, let's save a child's life for Mother's Day by locking your guns up. We did the same thing during Christmas time. Let's save a child's life for Christmas. All this is going on in Gary, Indiana. This thing, we also try to get kids to go into medical school. But most importantly, we're stopping and bleed everywhere we go. Every kid we encounter, they're learning that. And then we're doing that peace tour. This is Juan Moore, the sons of Wanye from Boys to Men, who were our big attraction. We went from school to schools in Chicago, at Inglewood, all the high endemic areas. We were there with these speakers and these motivational partners. And then that card that you have on your table is the card we have here. We give to every kid, showing them prices, resources, but also giving them the website for National Save. It's free, it's online, and it teaches kids how to be better stewards at preventing violence. And it can be easily something that they can get. And that's the information that that QR code has. It's for both Chicago and Northwest Indiana. It gives them the information they need when they need it. They may come to me on the night saying my boyfriend broke up with me and I want to kill myself. They're going home. But yet 2 weeks later, when their mother gets shot, they may really want to kill themselves. So having that business card can be a blessing for them to call the right people, because they may not get to me in these yards. So that information is specific to these cities. Why can't we do this in every city? It's a business card, easy, cheap. We gotta have money to do it though. So we got a whole plethora of things we want to do that we need resources for. And so I know it seems impossible until it's done. And we're working our way there. So we got a few more seconds. Thank you for the applause for that presentation. But it's 9:49. I think I can take 2 questions before we're done. Just one. All right. Anybody got a profound question they want to ask? Oh, her hand was up first. Please give her the mic. And then you guys have a break after this, I think, right?
We have a break, yes.
Okay. All right.
Good morning, everyone. Thank you so much for this presentation.
as a parent, I'm always moved by the role of parents in preventing gun violence among our own children and how we can leverage the resources that you highlighted, the folks in this room, to be more engaging with the parents and to bring the parents into these coalitions and to guide their children around the images that they see and what's the impact of those images. How do we leverage the parents to be partners in prevention by controlling some of the things that their children are exposed to? And what are the efforts to help parents better manage, whether it's screen time, whether it's the video games, whether it's the music? What are tools that are being provided to the parents?
I want the ladies answer that question.
I'll start with this, and I'm putting on a couple of other hats. I shared that I am on the board of Peace for DC. DC next to Dr. Mitchell is here. And actually, let me also just pause and note the source of the education for so many of us who were in public safety in DC. I attribute just a great deal of gratitude for Dr. Mitchell and all that he's poured into so many in the District of Columbia, and I know and beyond. So I want to start there. I also think that there are multiple tiers in terms of this work, and I know that we all have a role to play. Certainly from the kind of community organization standpoint, it is not parent agnostic. If anything, it is an invitation for parents, because we know that parents and family members, I'll broaden it up beyond that, are kind of a first line of defense. And so the more we're able to engage with parents vis-a-vis these community organizations, the better we are as a community. So I would also offer that it's an invitation to get smarter from parents and family members as to how to lean in to these issues, to these organizations. Parents, family members have a lot going on. And right now, folks are feeling overwhelmed. That's not lost on us. So we want to be thoughtful about how we use technology to stay connected to one another, how we can celebrate and support organizations like the ones that I know in DC, but also those that are happening that have been teed up across the country. How can we band forces? The last thing I'll note is with regards to parents, and this may be Dr. McGee, something you're experiencing, you have experience with in Chicago, but that business card, what are the resources that we have in place for parents to also signal, I have some information, but I'm also in need of support? How do we make sure that our parents, we have this bi-directional relationship with parents? So not only are they the ones that can convey information to their children, their loved ones, but also they can convey information to organizations so that we can make sure that our young people in our communities are stronger.
Awesome. And with that note, we're going to go ahead and get ready to close. I do want to thank our panelists. I do want to get a verbal commitment from you guys by a simple yes, say that you're going to agree to work with NMA's Violence Prevention Council. That's one. Yes. All right. So thank you guys for the time. By the way, please take that QR code home, watch that video, shoot your kids. How to stop the bleed with that video and be ready for NMA in Chicago. And also follow these calendar events and take a business card. Thank you so much.